Good day, you're welcome to my YouTube channel. My name is Chioma Obi and I'm the founder of My Health and Lifestyle, which is a community I created to create awareness for congenital disorder in newborn. Also, we are going to be looking at personal and health development, positive habits and lifestyle. If you're new to my channel, please subscribe and click on the notification button so that you'll be the first to know when I post my next video. If you're an old subscriber, thank you for your support. Thank you for being here. Don't forget to like, comment on the video, share, tell your friends to tell your friends. Today we are going to be talking about Down syndrome, which is a congenital disorder. Let's go. Hello, you're welcome back. Now, I am sure that a lot of you have seen at least one baby with Down syndrome, but you don't know it is Down syndrome. So, after this video, you should be able to recognize a baby with Down syndrome when you see one. So, it is a birth defect because it's a problem with how a baby's body parts are formed or how they work. It's also called a congenital disorder because it is a condition that is present from birth. However, it might not be recognized immediately a child is born. It can take a few days to a few weeks to recognize it. It's a very big call for concern because according to research, out of every 33 babies are born with a congenital disorder. So I think it's something that we should be concerned about. We should find a way to curb them because there are actually a lot of ways to prevent them. So, what is Down syndrome? It is a genetic condition that could cause mild to serious physical and developmental problems. Yes, it is genetical because it involves, replication of genes. Sometimes, when a mother is pregnant with her baby, an abnormal cell division happens, which leads to an extra pair of gene in chromosome, especially at chromosome 21. It's called trisomy 21 because 95% of the time, trisomy 21 is the major cause of Down syndrome. Although there are other causes called mosaic and translocation, but since trisomy 21 is the most dominant cause, let's talk about that only. So let me explain it as simple as possible. So a child inherits 23 chromosomes from each parent, or 23 from the mother, 23 from the father, which sums up to 46, right? So this is what happens. Is there are pairs of genes at different positions on a chromosome. So at chromosome 21 is an extra pair of gene, and that's what causes this abnormality called Down syndrome. The causes could be genetics, maybe due to what the pregnant mother was exposed to during pregnancy. Certain environmental factors, maybe certain foods, could cause an abnormal cell division, which leads to Down syndrome. Another thing is the mother's age. Women who are 35 years and above are at higher risk of having babies with Down syndrome. And if you've had a baby with Down syndrome, there's every chance that you're going to have another. Or if Down syndrome exists in your family history, the only way to prevent this is to start your prenatal visits as early as possible. Work with your doctor. There are certain tests that can be performed on a pregnant woman. Example is the karyotype test, which can determine if a baby has the chances of being born with Down syndrome. And there are other more invasive tests which scientists will tell you about that could help to determine if the child will be born with Down syndrome and this baby could be helped. So if a few days after birth you notice your child has a flattened face and almond-shaped eyes which slant upwards, if you can see from the picture, they have short necks, small ears, a tongue which sticks out like this most of the time, and they have poor muscle tone, loose joints. That's why most of them don't walk very early in life. If you look at their iris, you see there are white dots scattered everywhere. If you notice any of these symptoms, it's very important you run to the hospital. Although a lot of them go on to live healthy lives, they live as long as 60 years of age, but some of them might be needing help throughout their life. So I hope that now you know one or two about Down syndrome. When you see babies with this Down syndrome, you should be able to recognize them. Please show empathy because it's very draining to take care of babies with this condition. And like I said, when you go to your doctor, a lot of speech, occupational, and physical therapies will be used to help them to live very healthy life. Okay, very fulfilling life. So thank you very much. See you next time. Please don't forget to like, comment, share this video because someone in your contacts might be needing this information. All right, bye.